Good morning, good afternoon, and good evening. This is the 2090th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Vansh. Today, our guest is Dr. Vansh Luniya, Associate Professor. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself, so that those who miss the session can watch it again. You can subscribe the same without paying any money. We have already uploaded more than 3,650 videos so far. So those who missed the sessions can watch it at YouTube at IFPH Homeopathy. And let me introduce the guest of the day, Dr. Vansh Luniya, has completed MD Homeopathy and working as an associate professor, Department of Physiology, the Government Homeopathic Medical GM Homeopathic Medical College, Sheldon, Maharashtra, is a consultant homeopath at Dr. Luniya Homeopathy Clinic, a Unity Homeopathic Multi-Speciality Center, Bhagwat Multi-Speciality Hospital, Sosik Park, Lab. Vansh Luniya is a homeopathy consultant practicing in Chhatrapati Zambavar Nagar, Aurangabad, Maharashtra since 2016. That means he has more than 10 years of clinical experience, and he has blended multiple schools of thoughts and gurus and trained under the most renowned names in homeopathy fraternity like Dr. Sinimal Sarkar, Dr. Faruk Master, Dr. Samananda Adhikari, Dr. Kumar Dhawale, and Dr. Anu Nigwatha. And he has won many awards and the National Chinmayasi COVID Warrior in 2011 and the Jan Silsar in 2024 and 25. The most influential dynamic young homeopathy in 2016 by the D.Y. Patil University and Heal Academy, mentor of many students and practitioners. Every weekend he dedicated time to solve their problems, believing in uplifting on colleagues and fellow practitioners. State level rank holder and proud alumni of Dr. Dhawale Memorial Homeopathy, Kalgat. And he holds special interest in treating gross pathologically advanced cases, autoimmune diseases, psychiatry, geriatric, CKD, and dermatological cases. He's a speaker to various homeopathy and clinical workshops. And today, Doctor will be talking about when small remedies come to the rescue surgical cases. We all know that usually we used to go ahead with the constitutional and rare remedy, but the importance of rare remedies in treating surgical cases is a very important thought. And let us begin the session with Dr. Vansh Luniya. Let us see how Doctor present these things, and we can enjoy the beauty of homeopathy in surgical disease also. We proudly welcome the guest of the day, Dr. Vansh Luniya. Welcome, Doctor.
Thank you so much, sir. Thank you so much for the wonderful introduction. And thanks for your team and IFPH for giving me this opportunity to share little that I know. I'll start with sharing my screen. Please let me know if the screen is visible to you. Is the presentation visible, sir?
Yes, everything fine. You can.
Okay.
Can go ahead.
Okay, sir. So today I'll present my session under the topic of dealing with surgical cases and how smaller remedies come to rescue and how they help in pulling us out in the situation of crisis. Okay, so to begin with, I'll share a detailed case wherein I'll share a whole case followed by the prescription and the explanation. And at the end, I'll share a list of remedies which have been useful for me in acute emergencies, not only surgical cases, but acute emergencies and also helpful in relieving distress in surgical cases. Okay, so shall I begin, sir?
Yes, already you have begun.
Okay, sir. So I'll start with a case. This case is of a elderly 70-year-old male patient who is a widower and watchman by occupation, belongs to the Maratha community. And to begin the case, this is a case of a non-healing ulcer. And it's an interesting case since this fellow was the watchman in my neighborhood. I got to keep a proper record of long-term follow-up with this patient. So one day I saw this watchman wrapping his leg with some scarf with some leaves, and I was curious. So I inquired, "What's the problem? What are you doing?" So he unwrapped it and he showed a huge ulcer, which was on his lower limb, and it was oozing. It was oozing very bad pus. It was having a lot of discharges. So I convinced him that I took his minor details and I convinced him ki, okay, let me treat you. We'll take the whole thing in detail and let's see what we can do for you. So in the left calf, on the upper part of the left calf, this pathology was there, huge deep ulceration. The fascia was exposed. There was a lot of slug. Okay. Along with this, there was very lacerated blackish edges, a lot of dry scabs and crusts. It was oozing and it was horribly smelling. Okay. And along with this, he had high grade fever. And since he was a watchman, he couldn't afford having leaves. He used to keep coming and doing his night duty job or with all these in this all these circumstances. And throughout all this detail, what I observed was there was no pain at all. There was no pain. Uh, Ever it happens that you see a very bad situation, a very bad case of ulcer, or a very deformed state where necrosis has begun, at least you will inquire how severe the pain is. The problem is over here, there was no pain. So going ahead, this was the ulcer. Before starting the treatment, this photo. He had approached some nearby general practitioner doctors, some small hospitals. At the end, he was advised you have to just keep on cleaning the wound daily, keep it hygienic. And few of the higher centers he was sent to through these general practitioners, wherein they advised him debridement, or if it keeps on growing, uh, he may end up have to ampute the limb also. So the details I started taking, this had happened after a trauma. And over a duration of 4 months, 6 months, it had gradually started increasing in size. If you can see the picture properly, you'll be able to observe there is a whole fascia which is exposed. The whole surrounding area is full of dry crusts. There is a lot of blackish skin. There is lacerated area, if you can observe that, right? And the thing is, this was a progressive situation. Try to understand an elderly person, a watchman, may be under a low socioeconomic status who cannot afford all these daily hospital procedures also, and he was advised debridement. Okay, so I inquired. The event was such around 5 6 months back. This happened. Some group of men entered into a society and with all sticks and with all these things. And being a watchman, he suspected them to be robbers. And without inquiring much, it was late night, and he started thrashing everyone. suspecting them that they are robbers. They have came to rob a resident or something like that, and a huge collision happened. And this alone man, this alone fellow, this watchman, 70 years old man fellow, he fought with all his might in this situation. He thrashed these five, six people in such a way that most of them were badly injured. One of them had to hospitalized also. That's what he shared me. And this caused a lot of chaos in the environment, and people started waking up and came and inquire, and all these things start. And in this brawl, in this fight, what happened? One of the robbers might with a sharp edge some instrument, he also hit this watchman very badly, and that caused a very deep injury on his calf. That's how this ulceration, this ulcerative process started. That's the event behind this uh, situation, and that's what we gained out of it. And further, when I inquired about his young age, young days, so he was like a gunda. He was like a rogue that people used to be scared of him. People used to run away when he used to come. He was like a gunda in that community, and it was a very normal thing for him to get into fights and brawls and all these things from a very young age. And he specially mentioned this to me that many times in this situation, whenever he went into fights and all these things, he barely felt the pain. This started coming up very frequently, so I was curious enough, why is it that a painful situation where the patient should exhibit signs of unbearable pains and different sensations, he was not able to. Okay. And other details what I gained out of this patient was there was a lot of insomnia complaints since many years. Uh, when the case was taken recently, his wife had passed away, and his son tried to kick him away out of his home. And in retaliation, this man was so stubborn and headstrong, he kicked off his own son and his daughter-in-law out of the home, and he acquired the place where he was staying. So, while inquiring what happened and how it affected you, he was like, I didn't felt any guilt, any emotions. I've been staying in this place for so many years, and this son of mine will kick me away. I'll not take that. He threw his son and daughter-in-law away. So this shows the headstrongness of this personality. Okay. So this is how the picture unfold in front of us. On inquiring further, we understood how dry this person was on his emotions. He never cried in life. He didn't feel the pain of loss of his wife. Very bad at expressing how he feels. Okay. And giving the history, once he also shared that some local leader was causing some trouble with his residents in a young age. He slapped that leader so hard that some political fellows picked him up for a job and something like that. So this audacious nature, So this audacious nature made him take up a personal driver of a politician, local politician, all these things. And he was having all these insomnia complaints. And at the end, he picked up a job of a watchman to support his bread and butter. Okay. And this was his routine. Whole night he stays awake. He looks after cleaning and all these things of the society. And once he returns, he sleeps for barely 3 or 4 hours in the morning after returning home. And that's his routine. So on inquiring about his clinical situation, about his ulceration, so he was advised debridement and skin grafting from a general surgeon. Or if this ulceration keeps on progressing further, he might have to get his limb amputated. Okay. So because of financial condition, low socioeconomic status, he couldn't afford that. Had COPD, had this habit of BD smoking, cigarette smoking for many years. Now the interesting thing for us as doctors, as homeopaths, to understand, to look for a cause beneath is this patient was non-diabetic. This patient was non-diabetic. So try to understand when it's a diabetic patient with such a kind of situation, with other auxiliary measures and treatment methods, at least when you are able to take down the sugar levels, the healing process initiates, or there is some ease on our side to deal diabetic ulcer patient once you control his sugars. Here he was non-diabetic with this progressive ulceration. This makes the situation a bit difficult. Okay, there is no such strong thermal. So what happened was I started with very smaller remedies, very simple remedies, looking at his audacious nature. All these things I started with Nux vomica. Then I went to arnica, considering it's an trauma, it's an injury turning into ulceration, gave arnica, but there was no effect. After a few weeks, I stepped down to Mercury I gave frequently. It only helped in drying up the pus. The suppuration was reduced to a certain extent, but there was no major improvement. So by this time, I had gone through almost 3, 4 weeks, and there was no much improvement. Okay, so what to do? Understanding the whole case scenario, we have used local medicines, small medicines, tried to understand his disposition as a person, such kind of audacious personality. We gave Merksol also, we gave Naxwamika, nothing helped. So I tried, I thought it's the time to review the case. So understanding the core of this patient, who this person is, who is this constitution. There is audacity, there is lack of emotions. His wife passed away, he didn't express emotions. Right. In If you try to interpret this thing as painlessness at physical level and lack of emotions or dried up emotions, say painlessness at the mental level as well, we can interpret it that way. Another thing with this ulceration, the good thing was with the ulceration, still the fever was there, which is a favorable sign that the vitality is in a good susceptible state. 101, 102, 103 fever with ulceration is a good sign. At least you know there is an active susceptibility. If you try to understand, this kind of ulceration has dug so deep that the fascia is exposed, there are discharges oozing out. You understand clearly it's a syphilitic kind of ulcer. So what to do? So understanding this scenario, I tried to keep those drugs away out of my mind, which were continuously coming back and forth in my mind to go higher potency, arnica, and all of these things. If the medicine has to be correct, there has to be some registration. Even after using 3 remedies, there was no registration. So I was like, let's see, let's follow this personality who is, and let's try to find out what helps him. So after understanding this core, I perceived this comes very, very close to OPM. OPM as a drug picture, OPM as a personality. Okay. So what I did to begin with, over here, try to understand, dear friends, as a young homeopath, it becomes a bit challenging for you to stick to just one medicine, especially when you are having a challenging case, or especially when you are having a kind of patient who is desperate enough to jump from one doctor to another, one hospital to another. So, I had just recently started studying some works of Clark, and I had came through this very good remedy called gunpowder. Gunpowder in 6x tablets, I started him on QDS basis, and I started OPM 3 doses every week for next 4 weeks, and with gunpowder. Okay, let's see what happened. So this was the whole scenario which changed, and it brought lot of relief to me as a physician. Within 4 weeks, within a month, the ulceration thing healed up. Can you see the difference? The kind of difference which was nowhere improving even after use of Merxol, even after using the whole granulation tissue has formed over there. If you can recollect and see the previous slide, the previous photo, there was a lot of blackish scuff. There was blackish, yellowish pus, which has dried up, which was dead skin. If you can recollect and see that, and you try to compare, whole lot of granulation tissue and lot of new skin has started forming over here, which is a very good sign. Granulation tissue has started to develop. The pus has stopped. The offensive discharges have gone within 1 month. Within 1 month. Okay. So how we assess this follow-up? So there was a new complaint that he started having itching complaint, which was not there. Secondly, there were some complaint of oozing of blood from this site. And the fevers which were there continuously, the frequency has reduced, but the fever has not gone yet. So, without wasting much time and understanding, we have given enough time for the susceptibility for the repetition of the doses to act in 200 potency. I jumped up to 1 m potency, 3 doses every 15 days, every fortnightly. But I kept continuing with gunpowder 6x. Try to understand over here, dear friends, when we understood the whole history of this man, this kind of indolent ulcer, this kind of pathology could have been developed when this man was also involved in fights and brawls when he was young. Then why at this age? Why at this age when he is emotionally dry, he is living alone? Okay, definitely he's carrying this state of painlessness at the mental and emotional level. Very fine, accepted about it. But ever since we have also used other 2 3 medicines which which usually help in these conditions, why they didn't help? At times the vitality happens to lose this property where the granulation tissue would have started developing or started to heal by itself. Many a times in such situations, it is better to complement such cases, complement such pathologies with such kind of medicines which are lower in potency and which will, in a very targeted way, help in relieving your pathology. So, hence, along with our indicated medicine, we started with gunpowder, which was being continuously given for 1 whole month. And now, from this point of time, also, we are still continuing it. Okay. Again, after 4 weeks, what happens? The ulceration is almost gone. It is, you cannot even find a sign if this place was looking so horribly bad just 2 months back. The pus has gone, offensive discharge has gone, bleeding which was there. Acha, tell me something. Why there should be bleeding in this situation when it was a full-blown progressive ulcerated state? There was no bleeding. There was just slough. There was suppuration. There was no bleeding. But try to understand, when there is new granulation tissue, the body tries to establish the good blood vessels over there. The good blood vessels help in granulation tissue formation. So whenever you are dealing with such cases and you are seeing signs where previously bleeding was not there and now fresh blood has started coming, it is a very good sign clinically as well. Okay. So bleeding which was present previously, it has stopped. You can see, you cannot see any kind of discontinuation in the on the level of skin, but this some occasional itching is present. Okay. So again, after a month, a thick scar is seen in the previous photo. If you can see, this is a scar formation. Scar is seen after opium. The fever stopped completely. And for the first time, this man says me, I am having very sound and good quality of sleep, which I have not had in so many years. So this is a kind of difference you can make to the patient's life. Okay. So going ahead, I felt here there should be no utility of again going ahead with opium. So opium 3 doses in the first week and third week, like that, 2 times 1 m was given in the duration of whole month. So over here, still seeing there is scar formation, there can be possibility that suppuration can happen. So I continued this patient with gunpowder in 6x tablets. So let's see. For next 2 weeks, I continued with the same. If you can see, there is no difference with this scar. Okay. It is still thick, it is clearly visible, it is very well on the surface of the skin. So gunpowder was stopped. Okay. And this irregular scar which has formed right now, I started this patient with thiosinaminum. So we'll go ahead. Why thiosinaminum? Thiosinaminum in 30 potency. I started repeatedly. See, try to understand something over here in this situation. This patient has now recently recovered from a ulceration to a normal state of skin. Here there is secondary intention of healing. If we go to try to recollect from pathology, the primary intention of healing, secondary intention of healing, this is secondary intention. And now if you don't treat this with right indicated medicine over here, see, we know this patient required OPM and OPM helped him, right? But now in this situation, since he has came out of all this situation, does he still require OPM? No. Over here, ulcerated skin has now developed into a state where it is a newly formed scar. So as soon as possible, if you will think of resolving this scar, as soon as possible, we will start giving medicines which will target this condition. It will get resolved. The older the scar, the difficult it is to resolve it. Try to understand this. Okay. So after 2 weeks, can you see the difference, dear friends? This scar tissue over here, it is how thick, it is irregular margins, it is elevated. If you can see, it is clearly visible, right? And if you try to understand over here, it barely looks like it has settled down on the layer of skin. So after 2 weeks, after using thiosinaminum 30 potency in repetition QDS for 2 weeks, that irregular scar which was previously, it has resolved. And again, try to keep track of all the events which have happened in the past. His fever has stopped. His fever has not recurred now. Okay. It was an active inflammatory state with septic condition where the fever was going till 102, 103. It has resolved and the fever has also not returned. Right. So let's understand what Clark talks about gunpowder. There's a very thin book, very thin booklet, which in which Clark mentions about this remedy gunpowder. As the name suggests, the gunpowder is the same gunpowder which we have heard since ages, where the gunpowder is used in weapons and bullets. And this was the situation when Clark has written about gunpowder. Those are the situations of wars. And if we try to study the history of homeopathy, we'll be very well aware. Even in all those situations, there were very well established homeopathic doctors, homeopathic hospitals, homeopathic asylums, and homeopathy was on a boom in those eras, in those days. Even the surgeons who were of the best of modern medicine that time, they were started to turning into homeopathy, and Clark was also one of them. So what Clark writes about gunpowder in his book War Remedy, he indicates that it is a medicine that can be used safely in septic fevers. In conditions there are boils, carbuncles, indolent ulcers which are not willing to heal easily. Okay, carbuncles, blood poisoning, venomous insect bites. It can be from bee stings, it can be from a hornet, or can be from scorpion, insect bites from honeybees. So basically, where there are septic suppurations, where there is a kind of sepsis in the body, a poisonous state has happened in the body, and the body is not able to eliminate it out from natural processes. And there are suppurations, there are pus forming tendencies. So, what Clark writes about is he mentions that in low attenuations, in low power, in low potency, 3x, 6x, 12x, in tablet form, it works better, especially the cases where there are low vitality. Try to understand, if you and me, we get injured with something falls on our hand, we get an injury, barely within a week, within 2 weeks, it starts to heal up, right? We have a good vitality, we have a good susceptibility, our body understands how we have to heal it in the best possible way through primary intention. But in situations where there is low vitality, even if the body is willing to, the body lacks the vitality even to heal a ulcer. Try to understand when to use very low potencies, 3x, 6x tablets, and when to use this medicine in higher 201 potencies. Okay, so, and he also mentions non-healing ulcers often benefit out of this remedy, right? If you try to understand, even after the course of OPM was over, we continued gunpowder for almost 1.5 months in repeated doses, because it's a low vitality. You need to stimulate it at that level with a I'll not say specific medicine, but with a medicine which has these qualities which can help the healing process, right? So about gunpowder, if you try to see through other authors or other books, we come across other clinical conditions in which you can use gunpowder. Other conditions like abscesses, gut poisoning, food poisoning. As I mentioned earlier, in cases of in cases where the vitality is not able to throw out the poison substance out of the system, right? So foot rot, if we are uh, if we are aware of this condition of foot and mouth disease which we find in cattle, this foot rot has came from Clark's work wherein he mentions that at the farmlands where horses were having gangrene in their feet because of some problems, that time gunpowder was given to these horses and that foot rot got better. So it comes in clinical understanding from there. Gonorrhea, herpes, infection, septicemias, ulcers. If we try to understand the clinical utility of this small medicine, we are able to understand how clinically you can apply in situations where the vitality is so low. Acne, bites from insects like that, boils, carbuncles, cut poisons, right? Gunshot wounds. We are in today's situation, we'll never see this, but when there were situation of wars, when there were doctors who were treating these situations, they knew what to use when. Right? Gunshot wounds, injuries, pyorrhea, toxicity, vaccinosis, and even in situation of worms. Let's try to understand what is about thiocinaminum. So, if we try to read through Boric, in the very first line, he mentions that internally and externally it acts as a resolvent. It dissolves the scar tissues. Dear friends, please try to understand Boric in between the lines. When Boric mentions a condition, try to understand in which different situations this condition can be multiplied and found through in the clinical practice. In to dissolve scar tissues, to dissolve tumors, he mentions tumors, okay? Strictures, where in lumen there is a discontinuity and over excessive growth in the lumen, and there are strictures which form, which obstruct the pathway. That time you have this medicine at your rescue. You can use it in strictures. Urethral strictures, I have plenty of cases wherein I have been using thiosinaminum side by side with the indicated medicine, getting better and better results. Okay, going ahead, keloids, fibrous tissues, cicatrices, etc. Wound healing by secondary intention, we discussed this earlier. Practical utility, internally in low potency, externally direct application. It's difficult to find direct application, and uh, it's better to give internally. That's what I have to comment. So again, thiocinaminum, try to understand the action of this very small medicine. You will find cases where there is excessive fibrin deposition in the body. In which situations you will see excess fibrinous depositions in the body? First thing is amyloidosis. If you have studied pathology, in the second chapter, it talks about amyloidosis. In between the muscles, in between, in the places where it should not be, there starts deposition of excess of collagen and these tissues, right? In what conditions is thiocinaminum useful? Deafness, keloids, photosclerosis. When the malleus incrustates in the middle ear, right? When they get fused, when the sound wave cannot pass through it, when there is some kind of rigidity, stiffness, there is no motion between the ossicles of the middle ear, otosclerosis, painful adhesions. Where will you see painful adhesions? You had an injury, you had a cut, you had got stitches from a hospital, the stitches have healed, but now what is happening? Between the dermis and epidermis, there is this formation of scar tissue which is causing adhesions. And these adhesions will be painful. At the site of operation, beneath the skin, there will be adhesions, right? We hear about them in the form of pleural pain, pleurisy pains, right? After once a pneumonia has healed up, right? There is adhesion and friction between the pleural sac and the lung parenchyma at the site of pneumonia. Those conditions, okay? Strictures, tinnitus, right? Adhesions, ankylosis. What happens with ankylosis? All these paravertebral gutter muscles and ligaments, they go into stiffness. There is lot of depositions over there. There are contractures, Dutrin's contractures, frozen shoulder, induration, lupus, even again Meniere's disease, stiffness. So there the early stages of osteoarthritis. What happens over there? The bones start to friction over each other. In uric acid diathesis, what happens? All these excessive uric acid and calcium depositions, they target a joint, and there will be frozen shoulder, there will be so when such kind of situation is there, try to supplement your prescription with a medicine like thiosinaminum. It acts as a resolvent. As I mentioned, as it is from boric, there is nothing new, just a repetition. A resolvent externally and internally for dissolving scar tissue, tumor, enlarged glands, lupus, stricture. Again, same thing. Electron opacities of the cornea. We have heard about for cataracts, that cinerea maritima, eye drops are there. But try to understand, as we very well know, the use of calcarea floor in lower potencies over here. Similarly, the use of thiosinaminum over here. Ankylosis, fibroids. Fibroids are what? They are again, there is a lot of fibrin deposition and a strong connective tissue which forms the hard structure. To dissolve that hard structure for a very long time in low potency, frequent repetition, you have to continue with medicines of this nature. Right? Dr. A.S. Hard mentions it is a remedy of old age. Tabes dorsalis. What is Tabes dorsalis? It's a syphilis. It's a secondary and tertiary stage of syphilis disease, not syphilis miasm, syphilis disease. Right? Rectal crisis, strictures in the rectum. Basically, when you are finding strictures or there is some discontinuity with the lumen of a structure, think of this medicine. It will help resolve. So this was the case I had to share. The important thing is that as homeopaths, we lose our hopes when we don't see results, when we give one medicine, two medicine, the prescription fails and we get depressed. What to do? We leave this case. Uh, Very important point I want to bring up to you over here is, are so many masters have written so many good literature, so many good cases with results, with failures. When they can do it, why can't we do it? It's our limitation that we are unable to go to the literature, read those books, and understand how they have treated things. So it's our limitation where we have to study and apply in our practice. If we fail, no worries. We are having more than 3,000 remedies. We have to study, we have to apply it. Right? This is a clear difference. This same patient was said by a surgeon that maybe you have to amputate the limb if this ulceration goes on increasing so progressively, or you have to go to debridement. Everyone knows debridement in a plastic surgeon, how heavily it costs, right? So this is the difference you can make to a person, right? So what is my learning through this case? The patient was advised debridement, skin grafting, all these things I have told you, and even a situation where amputation could have been the last option, but everything got better with homeopathy. Secondly, surgical cases, yes, why not? We can treat it with homeopathy, right? But understanding the situation, understanding the pathology, the limitation, the pace with which the illness is progressing, it's our responsibility to understand a surgical case. How can we correct a surgical case with just one medicine? Maybe we can accelerate the vitality, the susceptibility towards healing, but there will be certain blocks which will require certain smaller medicines which will address uh, the pathology over there. 6 months of standing indolent ulcer, when he had came to me without a knife, it got resolved, and his uh, limb got the freedom from amputation or debridement. He didn't have to go under a surgeon's knife. That's important. So the utility of lesser or rarely used medicines in such kind of acute emergencies or such kind of surgical conditions. Remedies apart from arnica, causticum, which we know which have effects after trauma. Apart from the usually used medicines, apart from arnica, what else you can think? Apart from calendula, what you can think? Apart from belly spur, what you can think in such situation? definitely opium as a constitutional remedy definitely helped improving, but the sleep quality, duration of sleep, the septic state of the fever, it got really well off with opium over here, right? I finished my case over here. Through my past 9.5 years of clinical practice, I have accumulated small groups of remedies which have been helpful for me in dealing with surgical cases, in dealing with acute crisis when it comes to emergencies in your clinic. So let's move on to a very short presentation of uh, very simple and lesser used remedies, but which help your day, which help your practice when it comes to emergencies. Okay. So to share a few indications from my practice based on case, just now how I shared you the case, all these medicines which I'm sharing you over here are my own clinical observations which I've used in my clinic and I've got better results out of it, and also with some references from the literature. The literature talks about these medicines and how we can replicate these results in our practice. So if anyone wants to take a screenshot or photo of this, they can take it. It would be helpful for them. But very importantly, going back to our practice, our chamber, it's very important. We pick up books and we start reading. We start reading the rare to rare literatures, the small literatures wherein gems of information are given. Right. So to begin with, ginkgo biloba. Ginkgo biloba is one of those medicines which helps in re-establishing a situation where there is a deficit of circulation, there is an infarct, there is some kind of occlusion, there is poor cerebral circulation. It will help when there is a recent event of stroke, or if there is progressive loss of memory, progressive loss of cognition in old patients who have had multiple events of infarcts or cerebral infarcts. Second thing, I also had a case of a gangrene which was set on a thumb of a patient, and luckily the patient's son was a surgeon. He sent the patient for homeopathy, and his understanding was the artery which is supplying the end of this thumb has got occluded and the gangrene has begun. To my surprise, the same this similar case, this case, it required a few months to re-establish that circulation with the help of this medicine, ginkgo biloba. Ginkgo biloba is a medicine which helps in re-establishing the circulation, and hence, through this clinical understanding, it helped with me in a patient to reverse that driving pain. Okay, Cardos benedictus. It is a lesser used, lesser known medicine. I got the pleasure of learning this medicine from my guru, my teacher, Dr. Sunirmal Sarkar sir. When we were in his chamber, in his Kolkata chamber, when we went to study, uh, I got to learn this medicine from him. This medicine is from the same family as Cardus marinus. Cardus marinus also has varicosities with complaints of piles in alcoholic patients, right? But when there are varicose ulcers which are having throbbing pain throughout the body, there are contracting pains, खींच रहा है ऐसा लग रहा है, something is pulling inside, right? In such situations, when especially there are oozing varieties of varicose ulcers which refuse to heal. So try to understand this remedy has affinity for the ulceration but of varicose character. Okay. So try to understand what system is bringing out the pathology. The ulceration can be a stomatitis ulcer and mucous membrane ulcer of the mouth. It can be of varicose ulcer of the foot, of the circulation, right? So a simple differentiation will help you jump from a indicated medicine for that system plus ulceration. The literature also writes it helps in strengthening the optic nerve. Hemamelis virginica, as we all know, it is known as the aconite of the venous capillary system. Okay. And open and painful wounds, if you are getting open and painful injuries, lacerations, if you are getting, instead of going to calendula, try using hemamelis. Given that there have to be signs of uh, passive oozing of venous blood. Hemobilis would be useful. I have handful of good cases the wherein there had been a history of DVT, varicose ulcerations, varicose veins with insufficient valvular functioning. Grade 3, grade 4 incompetent valves in varicose veins. I have follow-ups of 2 years, 3 years. The valvular functions have re-established and started working. I have things on reports. So I can say that Hamamelis has helped in such situations. But helped in such situations in low potency, frequent repetition, understanding the pathology and susceptibility of the patient for a long term, not just 1 or 2 doses. Next medicine is Crocus sativus, threatened glaucoma and embolism of the artery, central artery, which supplies the retina. This happened to be a close relative of my family, uh, whose ophthalmic surgeon had um, advised them that this is the situation. The embolism has there can be situation there can be permanent blindness. So to my rescue, Boric helped me, and Procosat I was in 1M potency had repeated this patient almost for 10 or 15 days, wherein the sight of the eye was restored. How beautifully small medicines, small clinical indications have been mentioned in such gem of materia medicas like Boric. Another medicine is Gettysburg Aqua. Gettysburg Aqua is one of those medicines, just like we have studied Thiosinaminum. Over here, there is fusion. Many a times on MRI reports, we see there is sacralization of vertebrae, fusion of vertebrae. The two vertebrae are stuck into each other. What happens to the nerve roots? They get completely compressed, and there is a lot of tingling, numbness, sciatica kind of picture which happens. So over here, it relieves these compressive pains of the nerve roots. It Jittersburg Aqua is one of those medicines where the bones get fused, where there is stiffness, where there is ankylosis. The patient cannot move at all. The neck becomes stiff. When he's lying on the back, his back doesn't touch the bed. There is such kind of bad situation of stiffness which has occurred over the years. Jittersburg Aqua helps relieve those situations. Another important medicine is Sol. Sol is an imponderable prepared from the sun rays, and I have chances of using this medicine quite a few times. In today's times, it's very common that females come to you that there is facial hairs, there is some kind of blemishes. They take kind of laser treatments, hair removal treatments. They undergo cosmetic. They go to cosmetic doctors for the removal of these things through lasers. What happens is with lasers, there are many a times chances it burns your superficial skin, and the skin when the skin loses the capability to again regenerate and reproduce and to restore the skin's normal texture, the normal what you say morphology. When it fails, Sol comes to rescue. But to understand in high potency, when there are cosmetic burns from these lasers, right, and superficial ulcers which do not heal in spite of many used medicines, it is not the medicine to be used at the first encounter. Try to understand it's imponderable. It's a very deep acting medicine. Use it in a very careful way. Bacillus number 7, it is one of the medicines from the bowel nosodes. When we understand bowel nosodes, it is one of the medicine. When you are having situations where there are ganglions, if there are epidermoid and dermoid cysts, which fail to break open, which becomes harden and harden day by day, it causes pain to the patient. Bacillus number 7 is one of those medicines which helps in resolving these ganglions, which helps in resolving these cysts. Okay, I had a case where a patient had a thyroid cyst, and there was no other detail available. There was no other detail available. Understanding this medicine score has this core has to resolve the cysts. I used this medicine infrequently, and I had used thiosinaminum 6x in that situation also. Within few months, the thyroid cyst had gone away. That case has nothing of constitutional detail. It was a lady from a rural place. So you have to understand how clinically you can apply and see the results. Next one is Hekla lava. In cases of osteomyelitis, wherein the uh, wherein the bones break down, There is lot of suppuration, excessive of pus is there. There are bony pains, degeneration of bones, where the body has lost the ability to stop such kind of situations. The kind of situations we get to read in aurum metallicum, in asafoetida, in syphilinum, such kind of situations. You'll need a smaller medicines when none of the other medicines, bigger indications are present, they are absent, and such situation you'll have to use medicines like Hecla lava in low potency for a long term in such situation, or maybe in ascending potencies. Next medicine which has helped me very well in cases of skin, especially palmar psoriasis, atopic dermatitis also. A very severe itching of the palm, of the back of the hand, too much of scurfing, scaling. But this is one of those medicines where there are a lot of skin tags on the body. There are a lot of warts on the body. Along with your indicated medicine, if you try to locally give this medicine or give the patient in the mother tincture form for a few months, it helps in dissolving these overgrowth, skin tags, and even warts. Next medicine of very good importance, one of my very frequently used medicine is Goteria gomeri. Guteria gomeri is a medicine which comes to rescue when many indicated medicines fail. A patient with cholelithiasis having repeatedly attacks of this cholelithiasis, uh, the CT abdomen shows there is lot of slough. The surgeon will always say go under the surgery, get the gallbladder removed at that point of time, even when your colestrinum has failed, when calcarea carb has failed, when medicines like macphos have failed. To relieve the pain of the obstructed GB calculus, Goteria gumeri is one of the medicine. Fat flabby like calcarea like constitution, flabby constitution. Along with that, if you can get hyperlipidemia, it is a very good indication when gallbladder stone is causing you or obstruction. Right? Elytris farinosa, another medicine. Uh, if you get females who are having repeated abortions, who are having repeated tendency for DNCs, multiple times they have done DNC to their uterus, they've scrapped their uterus like anything. This has made the uterus the weakest point of the body. This has resulted in multiple fibroids happening in the uterine sac. The uterus has lost its laxity. The broad ligament which holds the uterus has become lax. The uterus lacks the ability to hold the baby and causes repeated abortions, right? Such kind of one medicine which strengthens the uterus, the china of the uterus, is Elytris farinosa. The anemic situation of the uterus to bear the baby, and on the other hand, it gets loaded with fibroids. It is also a medicine you can use when there is right-sided inguinal hernia. Next is arnica. Arnica, as we all know, it is the most very well used medicine. Our bread and butter depends upon arnica. The most important indication in acute situation when you are having a patient of angina, you are not aware if the angina is uh, through a myocardial infarction, or the patient is going into such a situation. The first thing you will do is you will send the patient to a cardiologist or to a nearest medical hospital, to a nearest hospital to get a ECG and get it diagnosed what is the condition. But till the point of time this patient reaches the hospital in high potency, maybe 1 m 10 m, give him arnica. Read through the heart and chest section of Boric. He clearly mentions the typical anginal pains which go from the left side of the chest to the right to the fingers. When this goes upwards, it is lauroseraceous. When it goes downwards, it's calmia. There are so many other medicines. But when in an acute situation, there is angina, you have no time to think, give arnica, high potency, push the patient, go, let him go and make him do a ECG. This will save his life. Right. Another indication, another medicine is plumbum I had just few weeks back. I had this small child. The parents bought him in their arms. इसका बार बार पेट दुखता है. Frequently, his pain is paining. The abdomen is paining. It has become unbearable now. Somehow they have done the CT abdomen. The local doctor are just giving him painkillers and sending him home. They are not able to understand on the report. On the report, this is my real life experience. I got to see a bowel intersusception over there. In intersusception, what you will do? I simply had this thought in mind. I need a medicine which will have action on colon. I'll need a medicine which will have such kind of acute pain. There is so much of emaciation in this boy. And if you try to understand this from a point of view of group study, you'll understand in acute abdomen, in intersusceptions, in the complaints of bowels, remedy will come to your rescue. And another thing, when you will try to palpate, the abdomen will be stony hard. The patient will not let you touch the abdomen, right? Sausage shaped mass in the right hypochondrium. That is kind of your understanding when it comes clinically. So dancing signage, it is known when you study intersusception from medicine, right?
Excuse me,
Next
sir,
is
only 5
adrenaline.
minutes. Sir, only
Sure,
5
sir.
minutes remaining.
Sure, sir. I'll finish it. Adrenaline in cases of syncope, angina, migraine, where head symptoms are from some space occupying lesion or compressive symptoms are happening, that time adrenaline will come to your rescue because of ischemia or some kind of compression. Next is cuprum Rs. Cuprum Rs I have used in Parkinson's and CKD. In cases of CKD where you're getting cramping pains in the body, don't take it very lightly. You'll require a very specific and quickly relieving medicine. One of them is cuprum Rs. It's very helpful in dealing with dysmenorrhea when there is lot of fainting is involved. No fainting, don't give cuprum Rs. My last slide, last 4 drugs I have to share. One is Cretivia Nurovala, where there is obstruction of calculus in the ureters, and it also a medicine which prevents stone formation. Solidago senecio aureus, just like I shared cases of CKD, where you are having severe spasmodic pains, severe UTIs with CKD. These two medicines will come to your rescue. Acute pains I am talking about. Okay, Diascoria villosa. Huh. We are talking about acute abdomen. It can be simple thing as pancreatitis, alcoholic pancreatitis. It can be some kind of acute situation which is troubling the abdomen. You have used belladonna, colocin. The regular medicines are not helping. Diascoria villosa, give it in higher potency. The only thing it is having the opposite modality of colocin. May be present, may not be present, but higher potency water doses relieves the pain in very short time when other medicines are failed, right? Nash writes it is one of those medicines, it comes in comparison with all these polycrest medicines when it comes to relieving the pain. And lastly, passiflora, as my using this medicine in cases of recurrent bronchitis and asthma, where the patient is unable to breathe, there is constrictive feeling. Passiflora is one of those antispasmodic medicines. It relieves it in a very short while. Or small children with nocturnal cough, they keep on coughing all night and they are gasping for breath. And in those situations, Passiflora relieves these complaints. The whooping cough with so much of irritability, Passiflora helps this. So with this, I come to the end of my sharing of using smaller remedies in clinical practice, maybe surgical cases, maybe emergency situations. But these are the medicines which will help you side by side with your indicated constitutional medicines to relieve the acute agony of the patient. Thank you so much, Dhanesh sir. Thank you, IFPH team, for giving me this opportunity. Thank you, Manoj sir.
Really wonderful presentation. Definitely you have the sharpness with precision. That is the most important thing. Congratulations. So it's time to combine the session. May I invite Dr. Bob Lim to express a lot of thanks. Dr. Bob Lim, please. Could you please express a lot of thanks, please? Dr. Bob Lim, are you there? Could you please unmute? He's from Malaysia. I think he's sleepy. It is well
I
past.
hope I was very crisp and to the point, sir.
Yes.
I tried to keep it.
Now, Dr. Binoy, are you there? You can. Dr. Binoy, are you there? Okay, anyway, nice presentation, wonderful presentation. Come to your platform regularly. Definitely, you can become a real source of influence in the colleges. Congratulations. On behalf of IFPH, expressing sincere thanks to Dr. Vansh and all those participants. This English session is time to conclude.
Thank you so much.
Again tomorrow.
Anytime you feel I can be of help to your team, I'll always be available. Thank you so much.
Yes, welcome. Thank you. Okay. So, Dr. P. Shaira to continue the Malayalam session. Thank you.